Hello to our health-conscious viewers. As we age, managing health often involves taking medications for various conditions. While these drugs can be life-saving, it's crucial to be aware of potential side effects, especially those affecting cognitive function. After age 65, our bodies metabolize drugs differently, and our brains become more sensitive to certain chemical effects. Worryingly, several common medications, some even available over the counter, have been linked to memory problems, confusion, and an increased risk of dementia in seniors. Today, we're shedding light on 5 common classes of medications that can silently harm your memory after 65. This information is vital for informed discussions with your doctor. We are not advising you to stop any medication. Rather, we aim to empower you with knowledge. Let's investigate. Medication Class 1, Anticholinergics. This is perhaps the most well-documented class of drugs linked to cognitive impairment in seniors. Anticholinergics work by blocking acetylcholine, a neurotransmitter essential for learning and memory. Common examples include over-the-counter sleep aids like diphenhydramine, Benadryl, Tylenol PM, Advil PM, and doxylamine, Unisom. OTC allergy medications such as diphenhydramine and chlorpheniramine. Prescription drugs for overactive bladder like oxybutynin, ditropin, and tolterodine, Detrol. Some antidepressants, including amitriptyline, Elavil, and doxycycline. Medications for vertigo or motion sickness like meclizine, Antivert, and the scopolamine patch. Certain muscle relaxants such as cyclobenzaprine, Flexeril. Why they harm memory? They directly interfere with memory formation and recall processes in the brain. Long-term use is associated with increased brain atrophy, particularly in memory centers. They can cause confusion, delirium, and blurred vision, symptoms that often mimic dementia. A large study published in JAMA Internal Medicine found that sustained use of strong anticholinergic drugs over several years was associated with a significantly increased risk of developing dementia, including Alzheimer's disease. What to discuss with your doctor? Ask if any of your current medications have anticholinergic properties. Inquire about safer alternatives, like newer antihistamines for allergies or behavioral therapies for bladder issues. Discuss the possibility of gradually reducing or stopping the medication under supervision. Medication Class 2, Benzodiazepines. These drugs are commonly prescribed for anxiety, insomnia, and sometimes seizures or muscle spasms. While effective in the short term, long-term use in seniors poses significant cognitive risks. Common examples include diazepam, Valium, lorazepam, Ativan, alprazolam, Xanax, clonazepam, Klonopin, and temazepam, Restoril. Why they harm memory? They act as sedatives, slowing brain activity and impairing cognitive processing. They interfere with the transfer of information from short-term to long-term memory. They can cause drowsiness, confusion, and poor coordination, increasing fall risk. Long-term use can lead to dependence and withdrawal, which may mimic cognitive decline. A meta-analysis published in the British Medical Journal found a significant association between long-term benzodiazepine use and an increased risk of dementia. What to discuss with your doctor? If prescribed for anxiety, ask about non-drug options like cognitive behavioral therapy. If prescribed for sleep, explore sleep hygiene practices and safer alternatives. Discuss a gradual tapering plan if you've used them long-term. Revisit the original reason for the prescription and whether it's still needed. Medication Class 3, certain pain relievers, opioids and NSAIDs. While necessary for managing significant pain, both opioids and some NSAIDs can affect cognition in older adults. Common examples include opioids, oxycodone, OxyContin, Percocet, hydrocodone, Vicodin, Norco, morphine, and fentanyl. NSAIDs, when used long-term at high doses, ibuprofen, Advil, Motrin, naproxen, Aleve, celecoxib, Celebrex. Why they harm memory? Opioids suppress central nervous system activity, causing sedation, confusion, and memory issues. Long-term use may alter brain chemistry. NSAIDs may affect blood flow to the brain or increase the risk of mini strokes, especially when used chronically. Research shows that older adults are particularly sensitive to opioid-related cognitive side effects. Regarding NSAIDs, studies are mixed, but caution is advised with high chronic use. What to discuss with your doctor? Ask about non-opioid strategies like physical therapy, acupuncture, Tylenol, or topical treatments. If opioids are necessary, use the lowest effective dose for the shortest time. Discuss the risks of long-term NSAID use, especially for chronic conditions like arthritis. Ask about safer alternatives and incorporate non-drug lifestyle strategies for pain. Medication Class 4, statins, cholesterol-lowering drugs. Statins are widely prescribed and highly effective in reducing cardiovascular risk. However, some seniors report cognitive side effects. Common examples include atorvastatin, Lipitor, simvastatin, Zocor, rosuvastatin, Crestor, and pravastatin, Pravachol. Why they might harm memory. In some individuals, cholesterol plays a role in brain cell structure. Statins may cross the blood-brain barrier and interfere with cholesterol synthesis in the brain. Some also affect coenzyme Q10 levels, which is important for brain energy metabolism. It's important to note, large-scale studies have not shown a consistent link between statins and dementia. In fact, by reducing stroke risk, statins may protect brain health in many cases. However, some users report reversible memory issues or brain fog. What to discuss with your doctor. If you notice memory changes after starting a statin, mention it. Ask whether your statin crosses the blood-brain barrier and whether switching might help. Discuss the possible role of CoQ10 supplements. Review your cardiovascular risk to determine if the statin and its dosage are appropriate. Never stop a statin without medical guidance. Medication Class 5, certain blood pressure medications. Beta blockers. Beta blockers are common treatments for high blood pressure, heart conditions, and sometimes anxiety or migraines. While vital for many, some types may affect brain function. Common examples include metoprolol, Lopressor, Toprol XL, atenolol, Tenormin, and propranolol, Inderal. Why they might harm memory, especially older lipophilic types. These beta blockers cross the blood-brain barrier easily. They may cause fatigue, confusion, and memory difficulties. They can reduce blood flow to the brain. They may interfere with neurotransmitters that affect alertness and memory. Newer beta blockers, like atenolol or bisoprolol, are less likely to cause cognitive side effects. Large studies haven't shown a general dementia risk with beta blockers, but individual experiences vary. What to discuss with your doctor. If you notice cognitive changes, ask about the specific beta blocker you're taking. Inquire about switching to a less lipophilic or more cardioselective version. Explore alternative blood pressure medications like ACE inhibitors or calcium channel blockers if symptoms persist. Make sure your blood pressure isn't dropping too low, as hypotension can also affect cognition. Conclusion: being aware of these 5 medication classes, anticholinergics, benzodiazepines, certain pain relievers, statins for some, and beta blockers, empowers you to have informed conversations with your healthcare provider. Key reminders: never stop or change medication without medical advice. Keep an updated list of everything you take, including supplements, and review it often with your doctor. Report any new memory problems right away. Ask about lifestyle or non-drug alternatives when possible. And if you take many medications, consider a full review with a geriatric pharmacist. Your brain health is precious. By staying proactive and well-informed, you can make sure your treatment supports both your physical health and your memory as you age gracefully. Next week, we'll dive into 8 natural ways to boost your immune system after 70. Don't miss it. If you found this video helpful, please like and share it. Stay informed, stay healthy. Until next time.